right, this is the case. Remember that we were talking about those hybrid dentures that are hard to clean? You know, look at this one. You have all the calculus that's up and beyond, up and under. There's the gold-plated ones. Anybody ever use the gold-plated curettes in their office? They're a little rarer these days, but they're out there still. They're probably the best out of the ones that you can use on the implants when it comes to removing calculus, at least the hand instruments. But you got to be careful not to damage the gold plating, because then there's stainless steel underneath and it could potentially damage it. And you can't put it in the ultrasonic planer or sharpen it, because again, you're taking off that plating. All right, home care. What is wrong with this picture? Anybody see the picture? See the toilet brush right over there? This is not at my house, I promise. But you have to give them credit. Whoever this was into home care. They have every gadget you can have. You have the Sonicare, several different brush designs. I don't know what that is, but you know, the toilet brush is definitely sticks out there. All right, let's talk about implant home care. You got to remember that it's attached ponic. It's not a tooth, so you got to treat it that way. It's round. You remember the implant is round, so you got to make sure that you teach the patient to go around the tooth as much as possible, around the implant as much as possible. Different than a tooth. It's also tends to be a little more lingual. So one thing you should try to do is try to tell your patients make them aware where the implants are. You know, these implants are underneath, and you have to get into these areas, these little nooks and crannies. And there's very different techniques that you should sit down and go over with your implant patients. And remember, a lot of these implant patients say, what do you mean? You put these implants in, I got to take care of them now? I thought they were artificial. Well, they're not going to decay. You know, at least you have that going for you. But everything else is still have to have proper maintenance. They still have to visit you in the same, even if they have no other teeth in their implants, they still have to visit you in the same period of time. You know, anywhere from 3 to 4 months. Of course, manual or automatic toothbrushes are helpful. But you know, this is the Hygiene Extravaganza, isn't it? This is the Hygiene Extravaganza. So we don't just show pictures of ultrasonics. I mean, of Sonicares. We try to show Matthew McConaughey. You gotta love this guy. Anytime possible, he knows a paparazzi around, he rips off his shirt and stands outside. And this one, they got him using a Sonicare. At least, you know, he's got good oral hygiene. You know, if you meet him, you know that's true. He's showing off his six-pack. I've got a six-pack too, but I hide it behind my keg. You know, it's there. So, this is the Extravaganza. We show Matthew McConaughey when we talk about the Sonicare. All right, floss threaders, of course, are a key. Superfloss, or what is that one, Diane? That Thornton's. Everyone see the Thornton's implant floss they make, which is a good one. You can only buy it online, but it's a good floss threader. It's even a little bit thicker than Superfloss and a little stronger. It's tough to get, though. I think you can only order it online. And you can wrap it, you know, because it is round, you can wrap the floss all the way 360 degrees around the tooth. And you can go horizontal, up and down, just to be able to clean. It's like cleaning a barber's pole, you know, be able to clean all surfaces of the tooth. The interdental brushes are also, you know, very important. They have to be nylon covered, though. You ever see, most of them are nylon covered these days, but you ever see the proxy brushes that just had metal? They're like the ones you can get from like the ShopRite. You know, sometimes you get like the generic proxy brushes that have the metal. Remember, the metal is going to be tough on the implant, so you want to have a coating around the surface. Yes?
We had a demonstration. We had someone here a year ago. She had floss tech interproximal brushes. They're like proxy brushes. They've come out with another generation where that metal is actually coating, and it really does seem to do a very nice job.
Yeah, you have to have some type of coating on it. The ones that lack attached gingiva, the ones that, and I should have put a picture of this in there, but lack of attached gingiva may be a little tender to this because, the implants sometimes, with positioning may come out a little more in the mucosa and not have firm keratinized tissue around it. In those instances, they might be a little tender to the proxy brush like device, an proximal cleaner. So you can get these sponge tips that they have that might be a little easier for the patient to use. And remember, a lot of it is not the product, but if they use it. So you have to be able to motivate them. Like David's talking about all morning, it's all about communication and motivation with patients and verbal skills. You got to get them to use something. These end-tough brushes or reduced size brushes are also very good. This is the sulcal brush. The end-tough brush, which we give out a lot in the practice, are good. Whatever can get into the area best to keep it clean. Rinses, of course, Paradex has, it's definitely its place. Chlorhexidine, they should be used right after the implants are placed or if someone has a very active situation, but it's a very short-term usage. You can't keep someone on chlorhexidine forever. It actually increases stain and in some patients has increased calculus buildup, which I think we've all seen in our patients. Good old Listerine for long-term use is probably the best to go. What's looking for signs? Now, David stole my thunder. I went through and through on the internet and trying to find unusual signs. He was a big, good sign person. So let's see my version of signs. Because with implant pathology, when you're looking for something wrong, you're looking for signs. Some signs are very obvious. You don't feed your baby to the alligator, but not everybody listens or sees those signs. This kid must be traumatized for life, but you got to admit he does look tasty, doesn't he? Look at that cute little hat. If you were a polar bear, you said, "Yeah, there's lunch," right there. Little tasty little kid. Some signs are obvious too if you look at them. Whoever floated that marketing idea, very smart. These two shirts were tested on animals; they didn't fit. And some signs are a little harder to see. Here's a Dunkin' Donuts receipt. If you read the fine print, don't forget to say hello to our special employee of the month, Janet. She may be slow, but she tries. Janet, did you work there before you went to Dr. Lewis? Is that Janet? Is that you? Is he referring to? What's even worse, I don't know if you guys picked it up. Whoever this person was, used Visa to pay for Dunkin' Donuts for $2.15. That is crazy. That is crazy. Go to Starbucks where you can pay $3 on your Visa card or $4. So look for the signs, and that's what implant pathology is all about.